Today, the Regional Integration Unit in the Office of the Prime Minister has partnered with the St. Lucia Athletics Association in bringing together a fun run, walk, move event. Our focus was to look at a different aspect of regional integration so that we're not focusing on the desk work and the things for which we are normally known, free movement of people and free movement of goods. Today's event is really bringing together people, focusing on health, on what we do to live healthy lives, healthy lifestyles.
The St. Lucia Athletics Association partnered with the Regional Integration Unit to put on this event this morning, this 5K fun walk. As you know, the athletics is about physical activity, and we believe in moving, throwing, jumping, being physically active, and we were more than happy to partner with this unit to ensure that this event was a success.
Very important for us was to be completely inclusive as possible. And so we tried to get very young people, very mature people like myself. We also have the persons with disabilities. We have participants who are wheelchair bound, and we have a representative from the Blind Welfare Association.
Well, first of all, the St. Lucia Blind Welfare Association has been pursuing an inclusive agenda from at least 1979. And so for us, the society must include everyone, regardless of his or her different abilities.
I want to find the RIU in the Office of the Prime Minister and the St. Lucia Athletics Association for inviting the National Council of and for Persons with Disabilities. Well, better inclusion, I can see there's a small gap, and persons with disabilities are being included in national events such as this.
You know, it gives me great pleasure to see that at last our voices are being heard. And from your level, from you said you come from the Office of the Prime Minister, the OECS, seeing the need to include people who are living with disabilities, you can't be wrong. And we are hoping that it would continue to germinate, and more institutions and agencies, not only in St. Lucia, throughout the OECS, will emulate your example.
We invited participation from students in various secondary schools within the Castries area. At least this is our first attempt. And we had representation from 5 of the secondary schools in Castries and environs.
I think the event was fun, challenging. I took my time, I made sure I breathe during the run, and I would encourage people to come and run because it's healthy and it's just fun overall.
Overall, it was a very good fun walk. I got an opportunity to be with my friends, walking, running, having a good time. And I encourage any one of you all to come to more of these fun walks because it can improve your health, and that it can just be a better opportunity for you to get more healthy.
I'm a track athlete, and I will encourage children to participate in sports and other activities.
I entertained this fun walk. It was very exciting, very easy. Light jog, I totally didn't fall halfway through. But yeah, I encourage more of you all to join and start doing more fun walks to encourage your health and your safety. Alright.
Apart from the actual walk, we've also brought in some of our health practitioners and partners. So we're encouraging people to look at their blood pressure, have their blood pressure checked, have their diet information provided, and so they can consult with our healthcare practitioners who can give them that kind of information.
We look forward to more partners with more agencies, more units, more departments, more of corporate St. Lucia to partner with the Athletic Association to ensure that we remain a healthy nation. We had a total number of 108 registered participants, and we had 61 persons who did show up for today's event, including the differently abled. And so it shows that with physical activity, you should not allow anything to deter you. Whether you physically or not physically able, we all can move. And so we encourage St. Lucia to remain a healthy nation, keep moving, keep participating. And the theme for today's event was moving together, one step, one community, one Caribbean. So let's all do this together.
We're looking at inclusiveness, we're looking at good health, and we're looking at this different aspect of integration as we promote the work of both the OECS and the CARICOM in integrating the region.
Coming out to those walks, one walk at a time, makes a difference. And I'm really appreciative that the Commission had this walk this morning and I was able to participate. I really enjoyed it. Thank you.
I must say it was a well-organized event. I mean, the turnout was not what I expected, but it was well organized.
Just would like to let everyone know that this was an exciting and fun walk, and that the next one around, I think that everyone should take part and come have fun. There's music, refreshments, and please, it takes one step to get anything started. Your health is the most important thing that you have. Always take care.
The walk/race was good. Although I reached late, I still managed to keep up with the others. Yeah, like I said, the walk was great and encourage others to take part in the walk. And yeah, stay safe and healthy too.
For the benefit of those who are not at the event, I would just like to share with you who our top performers were. First place, we had Neville Dupre in 20.12, 20 minutes and 12 seconds. Second place, Gerald Charles, 20 minutes, 38 seconds. Third place, Nathan Mosheri, 21 minutes, 48 seconds. For our female top finishers, we had Karina Monero in 27 minutes, 11 seconds. Emmy Emmanuel finished second in 35 minutes and 1 second. And in third place, we had Gabrielle Randat in 36 minutes and 51 seconds. Our youngest participant, only 2 years old, Nain Monrose in 1 hour and 2 minutes. And our oldest participant, Anthony Avril, well known, of course, from the Blind Welfare Association, in 1 hour and 5 minutes.
Very important is that this is essentially phase 2 of our health initiative. In July, we had the Caribbean Connection cycling event in which we had participants from St. Lucia as well as Martinique, Barbados, St. Vincent and the Grenadines within the region. So again, bringing that regional focus to events that are making us look more closely at our health, because clearly if we do not have good health, then we cannot be talking about regional integration. We cannot be talking about movement of people and seeking jobs throughout the region. So focusing on ourselves, our health, as we promote regional integration.